friend of mine recently had a C-section and she contacted me and asked me if I could recommend some of the best core exercises for her to do. So I told her that I would do a video blog post for her. And whether you've had a C-section or not, these exercises are very beneficial to anyone who's looking to strengthen their core. I'm also going to show you a couple different ways that you can actually assess your core muscles to see if they're functioning properly, and you can use these assessments as a baseline to determine a starting point for your strength training program. So just to give you a little bit of background information about your core anatomy before I get into these assessments, I just want to explain a little bit about the muscles in your core. Your core is very complicated, and there are a variety of different muscles in your core that have a variety of different functions. But basically what I want you to understand right now is that there are two major groups. You have your outer muscles, or your outer unit, which are responsible for movement, and you have muscles like your obliques and your rectus abdominis muscles, where if you train them properly, you'll have definition in your abdominal area. And then you have your inner unit, which is comprised of stabilizing muscles. And these are the muscles that I'm going to teach you how to train properly. And unfortunately, most people do not think to train their stabilizing muscles, because these are the kinds of muscles, no matter how hard you train them, you're not going to see them because they're very, very deep. So I'm going to get into the assessment first. The very first assessment I want to show you is called a transverse abdominis assessment, or TVA assessment. And your transverse abdominis muscle is basically like an internal weight belt, and it's responsible for helping you stabilize your body. So if your TVA doesn't function properly, there's a good chance that you're not stabilizing your body, and you're looking at a likelihood of injury. So there are a couple different ways that you can do this. The most efficient way to do it would be to just put your hand in front of your belly button, and I'm just going to turn to the side so you can see this. And you want to stand nice and tall and relaxed, shoulders back. Put your hand right on top of your belly button, and just try to draw your belly button in away from your hand, and then relax. The best place to do this is actually in front of a mirror, so that you can actually watch your hand, because you may have the tendency to want to pull your hand away from your belly button and cheat a little bit. But if you are unable to pull your belly button in, that is a sign that your transverse abdominis muscle is not functioning properly. So I'm going to show you an exercise that you can do to strengthen that muscle. So I'm going to come to the floor, and this exercise is called a 4-point tummy vacuum. So you're going to come onto your hands and knees, and you want your head in line with your back, so you want to be in a neutral position. And I'm just going to put my hand on my belly button as I'm showing this to you. What you want to do is take a deep breath in, and as you do that, your belly will fill up a little bit with air, and then you want to exhale and pull your belly button toward your spine, and you're going to hold it for 10 seconds. I'm just going to hold it for a few here, and then you're going to relax again. Take a few second break, and then inhale, fill your belly button up with air, and exhale, drawing your belly button in and holding. And you're going to do that for 10 repetitions. So that's a great way to strengthen your TVA. I'm actually going to show you a couple of ways now to test your lower abdominal strength. So I'm going to come onto the floor again. This time I'm going to come onto my back. And this exercise is not appropriate if you have any kind of back pain. So I will show you a modification if you have back pain. But this is a great way to test how strong your lower abdominals are. So I'm just going to bend my knees to get in the starting position, put my hands underneath my lower back, and bring my legs straight. And then the object is to keep your back completely flat against your hands as you lower your feet to the floor. So I'm going to do this very slowly. Good. Now that exercise is very, very challenging. It's not as easy as it looks. So again, the goal is to keep your hands underneath your lower back, and you want to keep your back pressed against your hands from the moment your feet are in the air all the way to the point when they reach the ground. Now, if you are unable to do that, and let's say maybe you can reach about a 45-degree angle, about here, you can use that as a starting point. And when I show you an exercise that you can do to strengthen your lower abdominals, you can use that as your baseline. And then you can go back and retest yourself and see how much further you're able to bring your legs down. Now, if you suffer from any kind of back problems or you have back pain now, a good modification to do as a substitute for that particular assessment is to do it with bent knees. So what you can do is put your hands underneath your lower back, just like you did the first time around. But this time you're going to keep your knees bent. And then you're going to lower your feet to the ground. And this particular assessment is a little bit easier because the load is not as heavy on your back. So if you are unable to do that particular assessment, it's a sign that you've lost the ability to stabilize your lower back and your pelvis against the weight of your legs. So an exercise that you can do to strengthen your lower abdominals is to come back into the position you were in for the assessment, and you can do a number of things. You can put your hands underneath your back, or you can keep them out to the sides, or you can actually use a blood pressure cuff, which is probably the best way to do it because you can actually read the millimeters of mercury on the blood pressure cuff to see how much the air increases on the cuff. But if you don't have a blood pressure cuff, it's very simple to do without one. So I'm just going to keep my hands to the side so that you can see, and I'll turn a little bit. So I have a little bit of a natural arch between my back and the floor. What I'm going to do is come into my starting position. Okay, so you're going to have your knees bent, feet on the floor, natural arch between the floor and your back. Take a deep breath in, and then you're going to exhale. And as you exhale, you want to tilt your back, or tilt your pelvis rather, so that your back is perfectly flat against the floor. And you're going to hold that for 10 seconds. And then you'll relax for a few seconds in between. Deep breath in again. Then exhale. And as you exhale, tilt your pelvis so that your back is flat against the floor again. And you can also do this exercise for 10 repetitions. So you can do these exercises every single day. That's the difference between training your stabilizing muscles and your outer unit muscles, because your outer unit muscles actually need more time to rest in between, where your stabilizing muscles are muscles that you can actually train every day. So what I would do is do these exercises every day for about a month, and then after a month, reassess your core to see how much stronger it's gotten. So I hope that information was useful to you. If you have any questions or comments, please leave them for me on my blog, and I'm happy to respond. That's all I have for today. I hope you have a great day, and I will talk to you soon.